right, welcome back to our next week of Science for Healthcare Workers. We're looking at the skills test. And last week we just reviewed, we looked at some of these initial skills and we watched the videos for them. We looked at hand washing. We looked at measuring a patient's weight. We looked at ambulate a patient. Remind me, what does the word ambulate mean again?
Move.
Move. Yep, we're helping them move. And so we're helping them get up and out of bed. We're helping them stand up. We're having them walk. We're moving them to a wheelchair. Ambulate is moving. And then we ended with looking at blood pressure. Today, we're going to look at these ones down here: recording respiration, mouth care, feed the patient, help in motion exercise, using a bedpan, and positioning patient on their side. Let's go. Let's start with measuring respiration. All right. Here's our measuring respiration. Let me move this here. Who could read this for us today? Who would like to read this?
I can do that.
All right, go ahead.
Count and record respiration. In this post, we will demonstrate another important CNA skill, which is counting and recording respiration rate. Respiration count should be taken for exactly 60 seconds. Note your watch carefully while taking the count. You must support the patient by holding the arm on the mattress while you take the count and make a record of the count.
All right, let's watch the video. Oh, there you go. All right, so here's what we do at the very beginning. We come in, we knock, introduce ourselves, identify, hello, Mrs. Jones, describe what you're going to do. Today, I need to measure your respiration. You get them to say yes. You close the curtain for privacy. You then say, well, let me go wash my hands and get all of my supplies. Wash your hands and grab the supplies. Are we good so far?
So far, good.
Mm-hmm.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
I'm doing great.
Wonderful. I need to get your vital signs. Is that okay?
Yes.
I'm going to close your curtain for privacy. Let me go wash my hands, get my supplies, and I'll be right back.
Okay.
All right. Glove rules. Who could read our first glove rule?
Use gloves when you may touch body fluids, personal skin, or non-intact skin.
Very good. All right, next one.
The first thing your gloves should touch is the patient.
Yep. So when you're putting on gloves, make sure that we're not touching other things, right? So it's like you put on gloves and then it's specifically, I'm touching the patient first. I'm not, oh, I'm going to go over here and touch this and do this and grab these things, grab the supplies. You do all that before. That was in the opening. Washing your hands, grabbing your supplies, and then you put the gloves on. Next one.
What have your dirty gloves touched?
Yep. And so really keeping that in mind. And then last one.
Remove correctly.
All right, that is a skill in itself, is how to actually remove the gloves without touching the inside of the glove, right? That you can like peel it off and then you peel off another one and then you end up where they actually are then inside of each other and then throw it away there. That there's a whole process of how to actually remove gloves. If you haven't seen that, you could just type it into YouTube and actually see some videos of how to remove gloves. All right, here's the skill itself. Who could read through these? First one.
Perform skill as directed on the care plan. The care plan, the whole care plan, and nothing but the care plan. Observe for any abnormalities, changes, or pain. Report all observations to the nurse.
Yeah.
Okay, Mr. Jones, this will take me about a minute. I'll let you know when I'm done, but I will need you to remain quiet during this time.
Okay.
I'm just going to lay this on your stomach for just a moment, okay? Ready? Start. Stop. Thank you very much, Mr. Jones. Is there anything else I can get for you while I'm here?
No,
All
thank
right. That was too quick. There we go. There's our closing. Who would like to read through our closing steps?
Ensure clean environment. Ask about comfort. Offer a magazine. Adjust head of bed if required. Bed height in lowest position. Give patient call light. Open privacy curtain. Wash hands. Document.
Yeah, and just like before too, just like with measuring the weight, wash the hands because you're done with the patient, and then write all the documents down.
So you better remember before.
I know, right? And so that's something, yeah, you have to hold on to that information too. And so, all right.
No, thank you.
Okay, your call light is here. If you would like anything, just let me know. Can I get you a magazine before I go?
No, thank you.
Okay, I'm going to open your curtain and wash my hands and then document. Okay, now I'll document my findings. I'll review the steps of my skill, make any corrections, and tell the evaluator.
And so when you're actually taking the skills test itself, and like I said, Benita will train you for that. I know with like hand washing, they don't necessarily make you hand wash. That's why if you notice the way that she's talking, that's not how you would actually talk if you were working with a patient. She's talking that way because she knows the examiner is watching her. So she says, oh, now I'm going to wash my hands and then record my finding, right? But she's saying that for the examiner. She's not actually going to the sink and washing her hands for the whole 20 seconds. Because if you had to wash your hands for every 20 seconds between each of your 5 skills for the test, it would take so long. And so you just tell the test taker, at this point, I would go and wash my hands. And so you would see that. And it would look just like these videos when you're taking that test. All right. So that was measuring respiration. Now let's look at mouth care. All right. Who could read this for us?
I'll do it. Providing mouth care is an essential CNA skill test. In this post, we will demonstrate how to provide mouth care to a resident. While providing mouth care, use of gloves is necessary. If the resident is unable to walk up to the basin, provide them emesis basin. Raise the head of the bed and brush the teeth properly along the gums and chewing surfaces of the teeth. The client can rinse his mouth and spit in the emesis basin. Dry the mouth with a clean towel. Dispose of the contents of the basin in the wash area and clean, sanitize, and dry the basin and store it properly wrapped in a paper towel.
All right, let's take a look. Here's our video. So this is everything that we will need. Any questions about these items? I think this is the only new word here, the emesis basin, right? But it's kind of this like curved shape thing that you can hold right under their chin.
Mm-hmm.
All right. All right, so the opening is exactly the same, right? You get into that habit of knock, introduce yourself, say the patient, hi, Mrs. Jones, I'm here. I'm going to help you brush your teeth this morning. Would that be okay with you? Let somebody close his curtain for privacy. First, let me wash my hands and gather my supplies. So this becomes a very natural routine because it's the same thing you do every single time. All right.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
Good. How are you?
Wonderful. I need to do mouth care. Is that okay?
Yes.
Okay, I'm going to put the head of your bed up. And then I'll close the curtain, wash my hands, and gather my supplies.
Okay.
We'll get you to a full upright sitting position for safety. And if I can get you to lean forward, please. There you go. Is that more comfortable?
Yes, much.
Okay, I'm going to close your curtain and wash my hands now. I'll gather my supplies. I'm going to start with a barrier.
So I wanted to go back and read that right there. All right, go ahead and read about our barrier. Who would read our 4 checkpoints?
Provide clean area for clean supplies.
Yep, so
Only-
you're going to put, keep going.
Only touch supplies with clean hands. Don't let supplies touch your uniform. First action taken after hand washing.
All right.
I'll gather my supplies. I'm going to start with a barrier, and we'll place that on your overbed table. I'm going to get a towel, a set of gloves, a basin, toothbrush and toothpaste, and a cup of water.
All right, let's look at the skills itself. Go ahead and read our 4 check marks. Oh, it's the same thing as before. And we've talked about this, that it's this idea of you follow the steps exactly the way they show you in the manual. And that's how you'll be tested of step 1, step 2, step 2, follow it precisely. Make those observations and report them. Let's watch.
We'll prepare the toothbrush first. get it wet, place a little bit of toothpaste on it, and set it in the basin. Mr. Jones, can I place this towel over your chest?
Yes, please.
Okay.
Because remember, the patient's the
And now
first
we'll
thing she
apply my
touches with her gloves.
Okay, Mr. Jones, can you open wide for me? I'm going to brush the back on the bottom. The back on the top. And can you bring your teeth together?
Now, here's what I want to know, ladies. What did they do to convince him to actually make this video?
Good question.
Right? Because, you know, they're just CNA students, right? That they're then
Yeah.
making all these videos with their current student. And how did he get the one selected? Hey, we're going to make a video of us brushing your teeth. Oh, how embarrassing, right? Who'd want that as a video? And it's out there forever on YouTube.
Mhm.
And stick your tongue out for me. Thank you. Set that aside. Go ahead and take a sip. Rinse your mouth. Let me wipe that off for you. Another sip.
No, thank you.
He's like, I'm done.
Okay.
Mhm.
Now
Get
I'm
me
going
outta here.
to dispose of my cup, wrapper, and toothbrush. I'll be right back. I'm going to remove the towel and place it into dirty linen.
All
Going to
right,
go clean-
basin cleaning. Go ahead and read these check marks for us.
Empty basin in sink toilet. Rinse basin. Use paper towel to pick up basin. Paper towel to dry inside, another to dry outside. Paper towel to collect supplies. Open drawer and store basin. Dispose of paper towels. That's a
Yep.
lot of paper towels.
Yes, yep. Because it's like once you're washing things, you will take a dry paper towel and use that dry paper towel to pick up things. So you're not touching them. You're keeping them as sterile and as clean as possible. All right.
Clean the basin, and I'll be right back.
I wonder if they will show us. Yep.
I'll place the toothpaste in the basin, use the paper towel to open the drawer, and place the basin and toothpaste in the drawer. I'll clean up my work environment and go throw these items away. Now I can remove my
Oh,
gloves.
let's watch how she takes off the gloves here. I'm going to back it up just a little bit here. Well, first let's read, and then I'll back up. Go ahead and read the closing.
Ensure clean environment. Ask about comfort. Offer magazine. Adjust head of bed if requested. Bed higher in lowest position. Bed height in lowest position. Give patient call light. Open privacy curtain. Wash hands. Document.
All right, so let's watch how she takes off these gloves. I'm going to back this up just a little bit, and let's watch.
Remove my gloves.
So she did that, how she like took off one and then held it in that hand and then went here and then flipped it up and around so it like captured everything. So she never touched with her skin the outside of the gloves. She only touched the inside of the glove. This gloved hand took off that glove, and then she took her bare hand, went inside the glove and didn't touch the outside, touched the inside of the glove and pulled it up and around, and then pulled it off to throw it away. All right, so again, a lot of these paper towels are like keeping things clean, opening drawers and all of those things, because she still had her gloves on. And so her gloves were then considered dirty. So then if she was to touch anything, use a paper towel to open drawers, close drawers, things like that. All right, so that is mouth care. Any questions about mouth care?
Nope.
All right, let's look at feeding a patient. All right, here are our steps. Who would like to read through these?
In this post, we are going to explain another essential CNA skill, which is how to feed a patient. Raise the head of the bed and sit on the bed while feeding. Use a spoon, but gloves are not required while feeding. Make sure the meal is according to the diet specified by the physician. Talk politely to the patient and make sure a sufficient amount of food intake. Encourage a reluctant client in doing so.
Because in this situation, so like if they're at the point where they are unable to feed themselves, they're often not wanting to eat either sometimes. And so you have to really be kind of encouraging, like, no, you need to eat some more, have a little bit more. You don't want any of that, let's try something else. You know, try to find something that they would like if they're not liking the current thing there. It's like, wait, would you like some ice cream? Would you like some pudding? How can we get more calories into you because you need to eat? All right, let's watch.
The skill I am about to demonstrate is feeding the client who cannot feed themselves. If you'll please notice, there will be approximately 4 to 5 pieces of usually fruit cocktail that you will be feeding your client. Also water and a name card on the tray, as well as a spoon. If at any time there is a fork and a spoon on the tray, you will opt to use the spoon only. Key points in this particular skill: you must be sitting at eye level with your client. They must be made aware of all of the food, the different foods that are on their tray. You must identify the client before feeding them by asking them their name. You will give them a choice of the food they would like to eat, and you must give them a beverage at least once during the meal. I will go ahead and proceed with this skill. Come in. Good afternoon. If you remember, my name is Kim. I have come to help you with your dinner. Could you please state your name for me?
Mrs. Rice.
Okay, great, Mrs. Rice. What I'm going to do is put your head up in an upright position.
Okay.
90 degrees, if you don't mind. I don't want you to choke on your food. Okay, how's that?
That's fine.
Okay. I think we're going to bring the height of your bed down just a little bit because I want to be at eye level with you when I'm sitting. Okay, I think that's good. Okay. Let me pull your tray over here so you can see what we have to eat. Okay. Oh, we have some cherries, grapes, and it looks like pears and a little pineapple, I believe. Does that look
Okay.
appealing to you?
Yes.
Okay, let me go ahead and just wipe your hands off of you, ma'am. Okay, great. The other hand, please. Okay, wonderful. What would you like to begin with?
The grape.
The grape. Good choice. Here you go. Okay. Keep chewing that. Okay. Would you like to try the pear now?
That would be fine.
Okay. Here's your pear. Would you like a sip of your water?
Yes, please.
There you go. Okay. How about that cherry? Would you like that?
Yes.
Okay. There you go. Is your mouth empty? Would you like something else?
No, I think I'm done,
You
thank you.
think you're done? Okay. Let me go ahead and wipe off the mouth. Okay, and if I could wipe your hands again too, please. Okay, the other one. Okay, let me just get rid of this, and I'll be right back to make you comfortable.
Okay.
I'm going to put this in the dirty area. Okay. Here's your call light, Miss Rice.
Okay.
I'm going to leave the head of your bed up for about 30 minutes so your food can digest. Okay?
Okay.
Alrighty, you call me if you need me.
Okay.
Alrighty, and I'm going to go ahead and wash my hands. And that concludes feeding the client.
All right, what did we see? What did she do? What are some of the important steps to remember?
Introduced herself again, made sure she was the right client.
Yeah. And I noticed that was interesting how she made her say her name, right? She didn't just say, oh, Mrs. Rice. She was like, oh, could you tell me your name, please? To come here. Yep. She said her name is Mrs. Rice. This is Mrs. Rice's meal. There's the name card. I'm ready to go. Okay. What else what other observations did you make of interesting things?
She wasn't using her hands to eat, so what was the reason for washing her hands before eating and after?
That's just policy, right? That it's like every time before and after a skill, you always wash your hands
No, not
to stop.
well,
Oh, you mean the
patient,
client
the
herself?
client, yes.
Yeah, I don't know. That's a good question. How they did kind of wash their hands. I don't know. That was a good question. But I think again, it's probably still just idea of being cautious with like the spreading of disease, since maybe they had touched some of their food, maybe they touched their face, because during the eating process, even if someone can't feed themselves, they often do tend to want to touch themselves, or they might wipe themselves. And so starting off with clean hands,
Mm-hmm.
and then same thing, that they might have some food on them, that ending it that way, that might be the case too. But yeah, that's a good question. I'd ask Benita Banks that one too. But yeah, she did wipe off her hands, the patient's hand who she was feeding before and after. What else did you see? What were some of those really important steps that need to happen?
Productions, keeping it clean.
She lowered the bed before she got started. Why did she do that? What did she have to do?
So they'd be eye level.
Yes, yep. So that was one of the rules too, and that's one of those things too, that when you're in that position of sitting down and feeding them, you want to be at the same level that they are at eye level.
We also told
Also,
her
what did she do when she... Go ahead, Eva.
she propped the bed to 90 degrees and told her she doesn't want her choking on her food.
Yep. And did you know she left her in that position and even told her, hey, I have to leave you here so you could digest your food for at least 30 minutes. So moved her up and then kept her there after eating. The other really big thing is that communication piece of telling them what you're feeding them, right? Oh, here's the grape. The grape is coming. Here's the pear. Here's your vanilla pudding. Here's your chocolate pudding, and communicating that so they know what you are also feeding them. And she also gave her a little bit of a choice too. What would you like to start with? Oh, good choice.
She
And
did
started
ask
her
if
with
she
that.
wants
So that
any water, any water too.
Yeah. She did ask. So, and it was kind of a mixing, right? That sometimes it was asking, right? Like, what would you like to start with? And then she waited after a while and she waited, and there was kind of that little bit of that awkward silence. And so then she was like, how about a pear? Would you like a pear next? And that was her way of being like, I'm still trying to encourage her to eat more because she needs to eat. And so, like, if they're not telling me something, I'm going to try to do everything that I can in my powers to persuade them to eat. Be like, ooh, would you like some pineapple? It's really good. I just had some earlier for my lunch. Really sweet today. You know, like trying to get them to eat more. Anything else I can get you? That type of thing. All right, so that is feeding the patient. Help with motion exercises is going to be our next video. All right, who could read this one for us?
Assisting patients in motion exercises of the upper and lower body parts is an important skill of CNA. The nurse aide must be aware of all the upper exercises, like the rotation of wrists and fingers, touching the chest and curls, arm and back wall, snow angel, wiper motion, etc. The lower body exercises include ankle rotation, gas pedal, knee to chest, snow angel, and long roll. A CNA must be able to assist them in doing these exercises and any other as per the directions of the supervising nurse. 2 videos are down below which will demonstrate how to help the patient in motion exercise. One video is for upper body part, shoulder, and another is for the lower body part, ankle and knee.
Yep. All right, we're just going to go down to the ankle and knee and look at those down there, the second video. So let's scroll down to the ankle and the knee, and let's watch some of the different exercises that they do.
The activity I am about to perform is called passive range of motion to both the ankle and the knee. I will first of all knock on the door.
Hello.
Hello, good morning, Mr. West. My name is Kim, and your doctor's asked me to do a little passive range of motion on both your knee and your ankle, sir.
Okay.
Okay? Now, please, if at any time this hurts, let me know and I will certainly stop.
Okay.
Okay, great. Let's go ahead and give you some privacy. Okay. And because of my height, sir, to save my back, I'm going to go ahead and raise the height of your bed.
Okay.
Now, I will be doing these exercises in repetition of 3. As I said previously, if at any time it hurts, please let me know and I will discontinue.
Okay.
Alrighty. And I'm just going to uncover this one leg and ankle. We'll start with your knee. What I'm going to do is place one hand under your ankle to support your ankle and one under your knee. I'm going to bend it towards your head, then towards the bed. Okay? That's 1. Is that okay? 2 and 3. Very good. Now we're going to go ahead with your ankle. What I'm going to do is I'm going to support your ankle in the back. I'm going to bend it towards your head, which is dorsiflexion, and then down towards the bed, which is plantar flexion. If at any time it hurts, please let me know. I'm supporting your ankle, and I'm not lifting it too high up. Towards your head, towards the bed. That's 1. 2 and 3. How was that, sir?
Fine.
Okay, let me go ahead and cover you up. I'm going to give you your call light, sir, in case you need anything. Let me put your bed in the lowest position for safety. That goes in. Okay, open this up so you can speak with your neighbor. Is there anything else I can do for you, sir?
No, that'll do it. Thank you.
Okay, well, let me go ahead and wash my hands. And that concludes the knee and the ankle passive range of motion exercise.
All right. So we didn't look at the shoulder, but you will see like all of the names of these: chest to curl, arm to back wall, snow angel, wiper motion. We saw the knee to chest. We also saw the gas pedal. This is where different institutions, clinics, hospitals might have different names for these. And so, but the exercise itself is the same, but the term and the name that they call it might change. So Benita might use actually different terms for these exercises, but they're the same ones. All right. Any questions about those?
Nope.
All right, we're looking at bedpan, how to use a bedpan. All right, who'd like to read about our bedpan?
In this post, we are going to explain how to assist a patient with the use of a bedpan. This is an essential skill, and CNAs must know how to properly place the bedpan. Place the bedpan flat on the bed and not on the bedside table. Position the bedpan crack to crack and give the resident a call bell before you going behind the scene. After the patient is done, assist him or her in washing the hand. Dump the waste in the toilet area and clean and sanitize the bedpan. Store it by wrapping it in a paper towel. The use of gloves while performing this duty is a must.
Why is it a must?
Because it's
Because you're gonna touch fluids on this one.
Yes. Yeah. Whenever bodily fluids are involved, gloves are a must. And that's why like brushing the teeth was also, gloves were a must, because you were touching, like you're wiping their mouth, you have access to the bodily fluids inside the mouth. Feeding, however, which I don't feel that necessarily makes sense to me, but feeding does not, because you're actually using like the spoon, right? And you're actually going and you're feeding them that way. But I'm kind of like, what's the difference between using a spoon and using a toothbrush? But brushing the teeth, that is, gloves are a must. Feeding, gloves are optional. But that policy may change, especially since of COVID, and because hospitals and clinics are doing everything they can to reduce infection, that feeding might actually be now, since you are working with things that are going into the body of the patient, they might actually make it that gloves are required now. That's something you'd have to ask at that specific clinic or hospital. That might be one of their new policy changes, that nope, we use gloves for everything now, just to be extra safe to stop the spread of disease. All right, let's take a look. Another thing that's not mentioned on here that you might be asked to do is measure it, right? That there, before you actually dump the waste into the toilet area, you actually use the graduated cylinder and you measure how many milliliters it was. So then you can note that down. That for a lot of patients, you need to monitor how much they're urinating. So let's watch the video.
My patient rang his call bell. He said that he needs to use the bedpan. I've washed my hands before entering the room. I enter the room and I ensure privacy by shutting the door behind me. I understand you need to use the bedpan, and I'm going to help you with that. Can you tolerate laying flat? He tells me that he can, because I'm going to need him to roll over to his side, and it's easier on their back if you have them laying flat first. I'll lower the head of the bed. You tell me if at any time you're not comfortable, okay? All right. I'll put on my clean gloves. And I'll raise the bed to a comfortable working height for myself, so I'm not bending over. I'll lower the side rail so it's not in my way and I'm not leaning over it. There are two different types of bedpans. One is a fracture pan, and this is for patients who have sustained some sort of injury to their back and they're not able to have something that's this tall underneath them. It causes them either too much discomfort or it's a safety issue. I'm going to lower your blankets, all right? And I'm going to lower them a little bit more than I probably would need to so that you can see clearly what it is that I'm doing. And I'll raise your gown so it doesn't get soiled. Now I'm going to ask you to roll over to your left side. If your patient's not able to roll themselves, you can grab the draw sheet underneath and hold it correctly using good body mechanics so that you don't hurt your back. And have your hands in this position so that you can use your bicep strength to turn the patient rather than the elbows. You can cause tendonitis in the elbow if you're turning them that way. 1, 2, 3. Excellent. Now some institutions, they'll put down a blue absorbent pad that's disposable prior to putting the bedpan under in case some urine or feces were to spill. Here I've got a pad that is laundered, so that's what I'll use at this institution. Now to get it under my patient without pulling his skin, I push down on the bed and slide it under the patient. And I make sure that it's centered well. Okay, you can roll back onto the bedpan. Assist your patient to roll back so that it's centered. Raise the head of their bed so that they're sitting comfortably, sort of as they would on a toilet. I'll remove my gloves the proper way and dispose of them. And cover my patient so that he's got some privacy while using the bedpan. Make sure that you lower the bed to its lowest position and give the patient either some toilet tissue or wipes in case they need to wipe themselves before you're able to return. Make sure they have their call bell so that they can call you. I would then wash my hands and wait for him to ring his call bell that he's ready to get off the bedpan. I don't want to leave him on there too long because that can cause tissue breakdown. So if he doesn't ring his call bell within a few minutes, I'll come back and check on him. The patient rang the call bell and said that he was finished. I washed my hands before entering his room, and as I entered, I shut the door behind me so that I provide him privacy. I'll raise the bed to a position of comfort for myself. And I'm going to lower your head slightly. I don't want to lower his head all the way down because then the bedpan might spill, but I want to lower it slightly so that when he goes to turn to his side, it's not so uncomfortable for his back. Okay, I'll put on my gloves and I brought some wipes. I'm going to pull your covers down. Okay. I'd like you to roll onto your left side. Okay. If they need your assistance, you can help them. As he's turning, I need to keep a firm hold of the bedpan. Otherwise, as he turns, the bedpan will flip to its side and dump all its contents all over the bed. I have a firm hold of the bedpan. As he turns, the bedpan is not turning with him. I'll wipe the perineal area front to back first. And now I'll wash the anal area. Now I'll remove the bedpan. Remove my gloves. Dispose of those. And assist my patient back to a comfortable position. Cover him back up. Put his head at a comfortable position for him. And then lower the bed all the way down to the floor. Now I'll need to don another pair of clean gloves in order to pick up the bedpan and take it into the bathroom. I'm careful if there are wipes in there that can't be flushed that I remove them before dumping the contents into the toilet. If my patient is on I&Os or intake and output measurements, I'll be sure to measure the contents before disposing of it in the toilet. I'll then clean the bedpan using the toilet sprayer and leave the bedpan in the bathroom. My final step is to wash my hands, and again, if my patient is on I&Os, intake and output measurements, that I'll log that into his chart or into the computer.
All right. What did we see? What observations did we see?
Washing hands, privacy,
Yep.
gloves.
Yep. And did you see how she took them off? We had a better angle this
Yeah.
time because it was off to the side, right? So she takes one, then she goes up underneath and is on the inside of the glove and pulls it up and over. And that's just a skill. Like I said, a skill in itself is putting on and taking off gloves and getting used to that. And so there's so many steps and so many things that you need to do. And it can be kind of overwhelming. And that's why I wanted to introduce this to you now before you get into the CNA program, so you are aware of these different skills that you will be tested over. Because like I said for last week, you really kind of want to start from day one, right? That tackle them a little at a time, because having to sit down and memorize all 30 of them at one time, like 1 week, 1 weekend, too much. You really want to take it in small, manageable chunks. Say, all right, the first week of the CNA program, I'm going to really memorize the first 3, and then I'm going to move on to the next 3, and then I'm going to move on to these 3. And you have it so that you have this plan so that by the end of the CNA program, you have worked with all 30 of them, you've memorized them, you could regurgitate it forwards and backwards, and you're ready to go. So when you take that skills test, you're comfortable and confident that you'll do fine. All right, so that was using a bedpan. We got one more last one, which we saw a little bit, was this idea of positioning a patient on its side and turning him over. And this will be our last video for today. So
Let's get it done.
all right, last one, positioning a patient on the side. Who could read this for me?
Okay, I can read it now.
Yep, go ahead,
Today,
Maurice.
today we are going to demonstrate another important CNA skill task, which is positioning the patient on the
Side.
side. A nurse aide must change the position of bedridden residents at regular times, intervals, or whenever a client requests. Ensure that the
All right, what does it mean? What? Sorry, Maurice. I'm sorry to cut you off. Just one thing. What does it mean if a person is bedridden?
It's always in the bed, like
Yeah.
He or she
That-
cannot get
Mhm.
out by himself.
Yeah. Yep, they don't have the strength or the muscles to get up out of bed and to be mobile, that they're kind of pretty much in bed all the time. And so we have to make sure that they don't get bed sores, that their body is moving enough throughout the day to stay as healthy as possible. And here's how we do it. Go ahead and read our bullet points, Maurice.
Ensure that the head of the bed is lowered and the bed is in flat position. Check the resident's arms and pillows. A half folded pillows must be placed at the back of the patient, one between the knee and ankle and one under the arm. Make sure that the shoulder, hips, and ankles are not in a straight line and bend the legs slightly while turning the patient to the other side. Never raise the head of the bed when the resident is lying down on one side of his body.
Yep. All right, let's take a look. All right, we're going to see the same opening that we see for all of them, right? You come in, introduce yourself, and it starts, and that's where, so studying for the skills test, it does get, you start seeing a lot of repetition, right? That all right, if it's bodily fluids, I'm using gloves, like that's built into it. They always start with that same opening. All right.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
Good, how are you?
Wonderful. I need to turn you onto your left side. Is that okay?
Yes.
I'm going to close your curtain for privacy. Let me go wash my hands, get my supplies, and I'll be right back.
Okay.
I'll start gathering your supplies. We'll start with a barrier, which I'll place on the table to provide a clean area to place my supplies. And I'll get 3 pillows from clean supply cabinet, being careful not to allow them to touch my uniform. Mr. Jones, I'm going to place this blanket over you, and this will help keep you warm and protect your privacy while we do this skill. Once I have the blanket in place, then I'll pull the sheet down underneath the blanket, making sure the patient remains covered at all times. Okay, Mr. Jones, if I could have you scoot toward me, please. I'm going to place your furthest arm above your head and cross your closest arm over your chest. I'm going to bend the closest knee and put the foot flat on the bed. And I'm going to angle the furthest knee out a little bit. Okay, now I'm going to turn you onto your side. 1, 2, 3. Okay, I'm going to take the first pillow and put it in an angle up against the back, and I'm going to tuck this top edge underneath the patient by pushing down on the pillow and under his back. This edge will roll up, and then it too will be pushed down and under, forming a roll along the back. Okay, now I'm going to position a pillow between the 2 legs by lifting the top leg and laying the pillow lengthwise between the 2 legs, specifically between the knees and the ankles, to prevent those bony areas from rubbing together. This pillow is going to be placed underneath the upper arm. This will help keep the arm in a neutral position as the patient remains on their side. And then I'm going to adjust the pillow underneath the head to make sure that it's not under the shoulder and it remains only under the head and the neck. And then move the arm to a more comfortable position. Is that comfortable, Mr. Jones?
Yes.
Okay, I'm going to place the call light directly in your hand. Are you comfortable?
Yes.
Can I get you anything else while I'm here?
No.
Okay, let me pull your sheet up. And remove the privacy blanket. Being careful not to dislodge all of those pillows as I do so. I'll roll the privacy blanket up and place it in dirty linen. The barrier will be thrown away. Okay, Mr. Jones, I'm going to open your privacy curtain now. Is there anything else I can get for you while I'm here?
No, thank you.
Okay, I'll see you soon. Let me go wash my hands. After washing my hands, I'll review all the steps of my skill, make any corrections, and tell the evaluator my skill is done.
All right, so that is positioning a patient on its side. Any questions about that?
No.
Okay, so again, like I said, that is the skills test, right? So this is something you will do at the very end of your CNA program, and just really look at the advice that I'd given last time, study as soon as you can, ask your teacher for advice, create study groups, practice with other people, also practice with the mannequins, right? Get used to talking to dummies that aren't another person, because that's kind of awkward at first, right? So get into that practice from the very beginning, knowing that this is that test at the very end that you'll have to do. All right. If we look at our homework for this week, so I have two things. I picked out two of those videos that we did. We had positioning a patient on the side that we just watched, and then recording respiration. So what you have to do as your assignments is go back and actually write out the steps. What is the first thing you do, the next thing, and write out that process with as much detail as possible of what that skill test looks like for those. All right, any questions about that?